watching Canadian Muslim News on Muslim Network TV. From Toronto, Ontario, I'm Catherine Bullock. Assalamu alaikum and greetings of peace. Today, a conversation with Reyhan Sarikaya about what it's going to be like going back to work after COVID. But first, some news headlines. Conservative leadership candidates clash over xenophobia, racism. Accused London family killer allegedly had access to dark web neo-Nazi sites. India court rules hijab inessential in Islam. Upholds ban. Ukrainian Mufti urges foreign fighters not to join Russian army. Now the details. Conservative leadership aspirant and Mayor of Brampton, Ontario, Patrick Brown, says his fellow candidate, Pierre Poilievre, has no credibility with immigrants due to his past support of Stephen Harper's niqab ban in citizenship ceremonies and a hotline to report supposed barbaric cultural practices. Poilievre, a Carlton, Ottawa MP, whom many consider a front-runner in the leadership race, accused Brown of lying and said there was no niqab ban. Poilievre announced that he will make it easier for new immigrants to practice their professions in Canada. An internal report highlighted the Conservatives' lack of success in immigrant communities during the 2019 and 2021 federal elections. New court documents revealed to the public show that Nathaniel Veltman, the 20-year-old man accused of killing a Muslim family in London, Ontario, may have had access to neo-Nazi sites on the dark web. Investigators filed 2 information to obtain applications to gather Veltman's electronic data ranging back to 2015. Police found that Veltman installed the Onion router on his laptop, which allowed access to the dark web, illegal services, and extremist content. Investigators and Veltman's lawyers were hesitant to release the documents in case widespread media coverage prevented a fair trial for Veltman. The Karnataka High Court, India, has ruled that the hijab is not an essential part of Islam and upheld the statewide ban on headscarves in classrooms. Lawyer Anas Tanweer told media sources that the decision was erroneous, as the question should not have been whether the hijab is part of Islam, but rather whether the state had the authority to ban it. Tanweer will represent the students' case to the Supreme Court. Government-run schools have been banning headscarf-wearing girls from entering classrooms since January, a practice that has sparked escalating protests between Muslims and Hindus. The Mufti of the Religious Administration of Muslims in Ukraine, Sheikh Said Ismailov, delivered a heartfelt message over social media Friday, encouraging foreign fighters not to join the Russian army. Mufti Ismailov said that those who joined Russian forces were accomplices in sin and crime. He asked Muslims around the world to support freedom and justice by fighting for Ukraine and defending their land. The UN reported that there are nearly 3 million Ukrainian refugees, with the civilian death count climbing into the thousands. And that's it for the news. Provincial governments have begun lifting the COVID restrictions. Masks are coming off, indoor gathering restrictions are coming off. The Northwest Territory's Chief Public Health Officer said, "We are going to go back to February 2020. To talk about what that might look like, we have with us the chair of the Northwest Territory Health and Safety Committee, Reyhan Sarikaya. Welcome to the show. Assalamu alaikum.
Assalamu alaikum rahmatullahi wa barakatuh, Kathy. How are you?
Fine, alhamdulillah. And it's nice to have you on the show.
Thank you. I'm pleased to be here, alhamdulillah.
So before we talk about what it's going to be like to go back to 2020, just share with us what the lockdown has been like for you for the last couple of years.
It's been difficult. I've got 3 children, and initially I was at home, but because everything was so new and the nature of my work, I wasn't even technologically set up to properly work from home. So there was this uncertainty about how to work from home. And then eventually we were able to head back into the office. Then I changed departments, and the new department was very well equipped to work from home. So there was a lot of rearranging, relearning, and readjusting to what this new workplace looks like and how it feels. And of course, coping with the anxiety and having the kids be at home, trying to keep up with their new work world, school world, and keep them on track. So wearing multiple hats at the same time.
And in all of that, you're also a volunteer and a chair, no less, of the Health and Safety Committee. Tell us what the Health and Safety Committee's been doing over these past couple of years then.
So I do this volunteer. My passion is the mental health and wellness safety within the workplace. So being a public service employee for the past 12 years, I see how people do struggle, but they just don't say anything. To alleviate that silence. That's what motivates me to do this volunteer work for the Health and Safety Committee, to really give a voice for the people who are suffering silence, but just don't have the means to perhaps have their voice heard.
How are you doing that? How are you helping bring their voices out?
So what I've done as a chair is I've initiated several calls within all the members. I've also done it pan-territorially, asking everyone the question, how are you holding up working from home? Letting them verbalize what it feels like, and then understanding depending on the nature of your work, because we've got teachers, nurses, we've got people working in correctional facilities, we have public service employees from different types of government. So everyone's nature of work is different. The stress that a teacher feels, maybe it's different from a cook that works in a correctional institution. So giving them that platform to sit and discuss how they're feeling, and then the rest of us can validate that and provide any support that we have.
Was there a common theme that came out that people are feeling?
I think uncertainty, just like I was, the uncertainty of not knowing. So how does this affect some people don't have the ability to go to work. Other people, they're forced to go, and now they've got the fear of, am I going to get sick? Or if I do get sick, am I going to get paid? What does that mean? There's a lot of that uncertainty, whether the sick leave is going to kick in and how long is that going to kick in. So a lot of anxiety and uncertainty about what happens when you get sick. That was most of and then how to stay safe in the workplace. If you're an essential worker, how safe is safe? Trying to find those answers.
We probably, in the beginning, there was all that anxiety, and then maybe people got a bit used to it, and now everything's being lifted and we might be going back to the workplace. But I sense anxiety about that change as well, like sort of coming out of the cocoon. Is that something that you've been noticing as well?
Oh yeah, now I'm very much, it's so funny. Now it's the opposite anxiety. First, I've heard members say that they're so uncomfortable using a public bathroom. They don't want to go back if they can do their work from home and they don't have to share any personal space with anyone, they'd rather do that. Or if they have a immunocompromised person at home. Now they're on a heightened sense of being alert, because they don't know when they're going to pick up something and bring it home. So most people, if there's been a bit of, like trauma, I guess, now they're even more scared, and it's we have to try and really help alleviate that anxiety. And
has the province consulted you and your committee on what going back to work will look like, on how to help address those new anxieties?
Well, lots of the employers have their own health and safety committees, so they will reach out to their own resources before they would come to us. But we like to, when the workers come to me and explain their issues, then that's when I can have their local leadership talk to the management's leadership, so we can get the conversation started.
And what's the most important thing that you want the employers to do to help address these anxieties about going back to work?
I think really treating everyone's situation individually, not to generalize. You can't assume that every parent treats, has the same childcare that someone else does. And everyone's socioeconomic situation is different. Everyone's resources are different. So you really have to give the worker the ability to express their situation and treat it on an individual basis, and have the person who can make the decision, not middle management, but have that person with the decision-making skills to hear them out and decide.
Based on your experience working with the employers, do you think that that's what's going to happen, or is it going to be one of those top-down management knows best approaches?
Pretty much, you hit it on the head, right? So this is everything is done in a perspective where whatever every employer, every company, every organization, how much do they value health and safety? The ones who value health and safety, is not going to make it difficult for the employee. But the ones that don't value it, well, then there's going to be those multiple steps and multiple hurdles to get through. So it all depends on what are the values and ethics of that organization.
Now, in your role on the Health and Safety Committee, do you get called in as an advocate to help a worker who might be dealing with a management who's not being very empathetic?
Well, the way the organization is built, so every workplace has their own local, and within that local, they'll have an executive. And that executive, if we give them the tools to sort all of that information out, and they're part of a component. So if their national office at a component level can't sort it out, then as a big umbrella organization, Public Service Alliance of Canada will step in and continue, give them more resources.
Right. I mean, you've obviously been very busy working, children, volunteering on this very, very important committee. Let's switch gears, though, as we close. You have a special scarf that you're wearing. Why don't you share the story of the scarf?
I just want to share. I'm wearing this scarf to show solidarity with the people of Ukraine. This is called the Kukum Scarf. So it's from the Indigenous communities. Across Canada, all Indigenous elders will wear this beautifully floral printed, multicolored, they come in different colors and sizes, of scarf on their head. And this was traded to the Indigenous people from the Ukrainian settlers. When the Ukrainian settlers were facing hard times, I really encourage all viewers to research the history of the Ukrainian settlers in Canada and their relationship with the Indigenous people. And the Indigenous people and the Ukrainians work together to make each other's community thrive and not go without. So one of the items that the Ukrainians traded were the scarves. And to this day, this scarf is still part of Indigenous culture. And it's you'll see a lot of elders wear the scarf. So, and across Canada, you will see more Indigenous people wearing the scarf to show solidarity.
Well, that's a really beautiful way to end. We thank you for all the work you've been doing, and we hope you well for the future. Thank you for joining us on the show.
Alhamdulillah. Thank you so much. I appreciate your time.
You've been watching Canadian Muslim News. Thanks for watching. Take care. Stay safe. God bless.